Welcome, and thank you for choosing Catholic Medical Center for your cardiac care. We have produced this short video to help you better understand your diagnosis of heart failure. After viewing the video, you will be contacted by one of our cardiac teaching nurses who will be happy to answer any questions that you might have. The heart is a hollow muscular organ which beats approximately 100,000 times per day. The blood flows through 4 separate chambers that are regulated by heart valves. The 2 upper chambers are called atria, and the 2 lower chambers are called ventricles. The valves separate the chambers, opening to allow blood to flow through them, and then closing to keep the blood from moving backwards. The right side of the heart receives unoxygenated blood from the body into the right atrium. The blood then moves through the tricuspid valve and into the right ventricle. The right ventricle pumps blood through the pulmonic valve into the lungs, where the blood receives fresh oxygen and gets rid of its waste gases. The blood is then returned to the left atrium and travels through the mitral valve into the left ventricle. The left ventricle pumps the oxygenated blood through the aortic valve out to the entire body. The 2 atria will pump together, and the 2 ventricles pump together to coordinate the flow through the heart. Damaged or weakened muscle function causes the heart to pump with less force, decreasing the amount of blood moving out of the heart. The heart chambers will attempt to compensate for this loss of blood flow in 2 different ways, resulting in either systolic heart failure or diastolic heart failure. Ask your provider which type of heart failure you have been diagnosed with. In systolic heart failure, the ventricle becomes larger in an effort to hold more volume and pump more blood volume forward. This stretches the heart chamber, which weakens over time, delivering less blood to your vital organs, such as the brain, lungs, and kidneys, until the symptoms begin to develop. In diastolic heart failure, the ventricle becomes thicker in an effort to pump more blood out. The thickened heart muscle develops fibrosis or scar tissue and becomes stiff over time. The ventricle is unable to fill properly, and less blood is available to be pumped out to your vital organs. Eventually, symptoms will also develop. Ejection fraction, also known as EF, is a measurement of the percentage of blood leaving your heart each time it pumps. An EF of 60% means that 60% of the blood in the left ventricle is pushed out or ejected with each heartbeat. A normal EF is 55 to 70%. A heart muscle that weakens in heart failure will have a decrease in EF, and you may begin to feel symptoms. Heart failure occurs when the heart muscle or pump isn't working properly. This pump failure can be caused by any number of factors, including decreased blood flow from the coronary arteries to the heart muscle, known as coronary artery disease. It can be caused by a damaged heart muscle because of heart attacks. It can be caused by an increased workload from high blood pressure or disease of the heart muscle itself. It can also occur in infected or diseased heart valves that put strain on the heart. Some people are born with heart defects that are present at birth. The heart muscle can be damaged due to alcohol, drug abuse, or medication toxicity. The heart muscle can also be damaged due to diabetes or strain on the heart muscle by abnormal heart rhythms. The most common symptoms of heart failure are a result of fluid building up in the lungs or other parts of your body. Symptoms can be a result of fluid buildup in your lungs include shortness of breath, wheezing, coughing during physical activity. You may have problems breathing while you're lying down and find that you need to sleep in a recliner or utilize more pillows than normal. You may find you wake up in the middle of the night coughing or feeling short of breath or have to urinate frequently. Other symptoms can include swelling in other parts of your body, such as your legs, ankles, and abdomen. You may feel weak or tired, have swollen neck veins, feel bloated, nauseous, or have loss of appetite. Finally, you can also experience symptoms of dizziness, confusion, or decreased alertness, and irregular or rapid heart rhythms. Heart failure is a chronic disease process that must be managed carefully by you and your care provider. Your treatment plan is designed to relieve some of your symptoms and make you feel more comfortable. In order for you to feel your best, you must follow the guidelines you are given closely. Compliance is extremely important. Following a low sodium or low salt heart-healthy diet in order to help reduce fluid retention, restrict your daily sodium intake to 1,500 to 2,000 milligrams of sodium a day. You can do this by removing the salt shaker from your table and not adding salt to your food. 1 teaspoon of table salt has 2,300 milligrams of sodium, which is more than your recommended daily allowance. There are several resources in your heart failure binder and lists of low sodium foods in that binder. The Heart Failure Information Binder or booklet has additional information about food labels, examples of sodiums in different foods, and advice from dietitians. You will also need to record your weight every morning to look for one of heart failure's earliest warning signs. Weigh yourself every morning after using the restroom. Be consistent with what you are wearing when you weigh yourself. Record your weight on the chart provided in your heart failure booklet. If you notice a weight gain of 3 pounds in one day or 5 pounds in 1 week, you will need to call your care provider. It is also important to restrict your fluid intake so as not to overwhelm the heart muscle. Fluids are usually limited in people with heart failure to 64 ounces a day, but your provider will prescribe the specific amount that is best for you. All liquids are included, such as coffee, water, tea, juice, and anything that turns to liquid at room temperature, such as ice cream or Jell-O. Your healthcare provider may direct you to lower the amounts of fluid you can have, and it is important to measure and monitor your fluid intake daily. Conserving your energy by spacing out tasks and coupling that with a regular exercise routine will help to manage the demands on your heart as well as strengthen your uninjured heart muscle. Your provider will order medications to keep your blood pressure low and improve the pumping of your heart. It is important that you understand your medications and take them properly. Alcohol can make your heart weaker, so please avoid it. Please do not smoke and avoid exposure to secondhand smoke. Your heart is working hard enough without the added stress of smoking. Learning to relax and manage your stress levels will help to reduce the workload placed on your heart. Your nurse will review all of these instructions with you and your family at the time of discharge, so please be sure to understand your treatment plan before you go home. Once your heart muscle begins to heal, it is strongly recommended that you attend a cardiac rehabilitation program. This is a special exercise program and education program tailored to cardiac patients to promote their full recovery. It provides outpatient physical conditioning with risk factor modification and education to promote your recovery and improve your overall cardiac health. A team of healthcare providers, nurses, dietitians, and exercise physiologists work with you to establish heart-healthy routines. Your cardiologist will supply a referral to the cardiac rehabilitation program that is closest to your home. Please schedule an appointment with them as soon as you are cleared by your cardiologist. We ask that you report certain symptoms to your provider promptly to ensure that you receive the appropriate treatment and to help prevent repeat hospitalizations. These symptoms will include weight gain greater than 3 pounds in 1 day or 5 pounds in 1 week, increased shortness of breath or fatigue at rest or with activity, inability to sleep with your usual number of pillows, or sudden awakening at night due to shortness of breath. You may also notice increased swelling of your feet or legs, a fullness in your abdomen. You may develop symptoms of chest pain or discomfort or a change in your usual chest pain pattern. You may also experience lightheadedness or dizziness. Close follow-up by your care provider is important to help manage your heart failure. Be sure to keep your appointments and bring a list of all your medications with you. In this way, your provider can monitor your condition and adjust your medications as needed to reduce your symptoms. You have been provided with a heart failure booklet by our hospital staff. Other resources include the patient channel now.com, utilizing the password 00019. These are free videos that you can utilize to help better educate yourself. And also look for quit smoking apps if this is applicable to you. Again, we thank you for choosing Catholic Medical Center for helping with your cardiac needs. We hope that this information has been helpful and that you begin to have a full recovery.